everybody, Dr. Deom here again at Hazleton Eye Specialists. I am here today with a great friend of mine, Megan Natal. We're going to talk to you a little bit about sleeping in your contacts. Very cool. Usually something we don't want you to do, but in this case it is something we want you to do. We're here at our Hazleton location, Hazel Township, Pennsylvania. Airport Road, 281 Airport Road, Hazel Township, Pennsylvania, 18201. Telephone number is 570-453-2020. And we also have a brand new location in Tannersville, Pennsylvania. It's gorgeous, huge office, wonderful location, very easy to get to, right off of Route 80. It's 2942 Route 611, Suite 5, Tannersville, Pennsylvania. The telephone number there is 570-421-3342. Call today. Great doctors there. I'm there occasionally. 5 great doctors in our practice. Give us a call at either one of our locations. We're here today talking about something new, something exciting, something called orthokeratology. Very scary sounding word. We're going to jump into that, but it is sleeping in your contacts, right? So what this does is it actually corrects your vision while you're sleeping. And the reason I have my good friend Megan here with me today is because she uses Ortho-K lenses regularly. So we're going to get into all of that, but I want to know, are you using any contacts or glasses right now?
No.
No?
Just the Ortho-K.
And how long have you been wearing glasses or contacts?
I've had glasses since I was about 2nd grade and contacts off and on since high school.
Okay. So, why off and on with the contacts?
I had a hard time finding contacts that I was comfortable with wearing the whole day.
Okay.
And I had some issues with dry eye.
Okay. All right. So you wore glasses, but you wanted to wear contacts, and the contacts gave you a lot of discomfort, so you're bouncing around different types of contacts. I know we tried daily disposable contacts, and that worked for a little bit. So here we are, now we're doing something totally different. You're sleeping in your contacts, and usually we say, no, don't sleep in your contacts, and here we say, do it. So this is all about orthokeratology, and we're going to get into that. But first, I want to talk about myopia. Myopia is the medical terminology for nearsightedness. And nearsightedness is actually an epidemic. And you may say to yourself, okay, Dr. Deom, that's kind of ridiculous. I don't really think it is an epidemic. You wear glasses, you see fine, and that's the end of the story. But there's actually something much more to that. And we're very lucky here in the United States. We have access to health care, we have access to glasses, but people throughout the world do not have access to these types of things. And in some parts of the world, we have individuals and groups of populations of people where nearsightedness grows exponentially throughout the course of your life. And I have, in fact, many patients that have nearsightedness that grows exponentially throughout the course of their life. In fact, 66% of individuals, 66% will become nearsighted at some point in their life. And 25% of school-age children are nearsighted. So this is a very serious issue, and it could affect the way you're learning, it could affect the way you see the board, it could affect many different, your self-esteem, your consciousness, your ability to do things that you want to do, like running. Right? Good, excellent runner right here, world-renowned runner. So very, very important. The other thing that I'd like to hit on with nearsightedness is that as nearsightedness gets greater, okay, if you're just a little bit nearsighted versus somebody who's very nearsighted, your risk of many conditions increases, okay? Did you know that? Did you know that as your nearsightedness increases, your risk for different conditions also increases?
No, I did not.
Yeah, so that's something we don't tell a lot of people, because we say, all right, well, you're a -6, we give you glasses. If you're -2, we give you glasses. But actually, if you're a -6, your risk for a retinal detachment is several times higher than what it was if you're a -2. So there's this sort of holy grail out there about how can we take a child whose parents are both very high nearsighted individuals and take that child who may be at age 8 a -2 prescription, a low nearsighted individual. They could see things maybe 10 feet away, and their parents are very high nearsighted. They can't see a hand in front of their face. And we say, how do we make that kid not end up like those parents? Because we know that their parents have a very high risk of issues like retinal detachments, also a much higher increase in risk of glaucoma, which is one of the #1 causes for vision loss in the world. Also a major cause for loss of functionality. In other words, you can't see the clock when you wake up in the morning, right? So lots of people have these issues. And so how do we make these children not turn out like that? So there's been lots of research done. There's a couple different things that have been shown to reduce the rate and progression of nearsightedness, okay? So how do we take a -2 and keep them a -2 instead of making them go to a -8, okay? So the top 3 things we have, one, are soft contact lenses with bifocals in it. Okay. Now this is a good option. It's a good way for a parent who maybe isn't interested in the other options we're going to bring up to ease into what we call myopia control. Okay, myopia control. And this is a way that we can, ease into it. It's a soft contact lens. It's easy. You wear it. And what this does is it changes the way light focuses on the back of the eye. And we believe it changes the signal to the brain that increases the length of the eye. And as we get more nearsighted, the eye does increase in length. So that's the first thing, the first option. The second option are eye drops. These eye drops are unfortunately very hard to get and a little bit pricey. So this is an option. It's something that we do occasionally, but we don't do it very often. It does work very well, but we have some other options that are a little bit easier. The third option is orthokeratology. Orthokeratology is a hard lens. You may have heard about hard lenses from your grandparents back in the day. We actually still use hard lenses quite a bit. They're uncomfortable, and we don't use them much anymore because of the comfort. But actually, they do provide very clear optics. So what we're going to do is we're going to take a little break. We're going to come back. We're going to talk a little bit more about orthokeratology and what it is that it does. Hey everybody, Dr. Deom here again at Hazleton Eye Specialists. We're at 281 Airport Road, Hazel Township, Pennsylvania. Telephone number 570-453-2020. And in Tannersville, Pennsylvania, our Stroudsburg location, Stroudsburg Eye Specialists, 2942 Route 611, Suite 5, Tannersville, Pennsylvania. Brand new location, beautiful office, definitely check it out. Great location, wonderful selection of frames and lenses. One of the first places in the area to carry Maui Jim sunglasses and optical frames. Beautiful frames, beautiful quality lenses. Come check it out, Tannersville, Pennsylvania, Tannersville Eye Specialists. So I'm here today with a great friend of mine, Megan and Tally. Megan, I just want to say this. I got to say it right now. Megan is a prolific runner. Prolific! Okay? And I dabble in running. I chase her. I can't keep up with her, but she's a prolific runner. How many marathons have you done?
21.
21? She said it kind of quietly. 21 marathons. 21. And so what are you doing 21 marathons? What's your goal? Do you have a goal? You just doing it for fun? What are you doing?
I am doing it for fun, but I have a bucket list goal of doing one in every state.
Awesome.
So 21 down.
21 down, a few more to go. And I was lucky enough to do one with her this year. It was a lot of fun. We went to Maine and did a marathon up there, and it's really great. Megan is in all honesty an excellent runner, and it actually has something to do with what we're talking about here today. So we're talking about orthokeratology lenses. Orthokeratology lenses are lenses that you sleep in, and we have a great Ortho-K lens here in our office, and I'm one of the only doctors in the area, northeastern Pennsylvania, actually the only in northeastern Pennsylvania that's certified to be using this lens, CRT lens, corneal reshaping therapy lens. You sleep in it, it changes your vision while you wear the lens. So it's kind of like a brace for your eyes. So before the break, we were talking to Megan about her experience with nearsightedness and the fact that she wore glasses and soft contact lenses, and I brought up Ortho-K to you. And do you remember what that conversation was like? Do you remember what I said?
I remember you suggesting it to me because you thought it would be good for my lifestyle, getting up early running, just popping the contacts out. Because previously, I would like to have worn contacts running, but I get up so early, I don't want to put them in.
Right.
They're burning.
I remember many a day, you and I, we meet up real early, go out for runs, and in the cold and in the hot, and you're sweating. And, with the glasses, what happens? You
fog up.
You fog up, right? And if you're wearing the contacts, sometimes you have discomfort there. And like you said, it could be uncomfortable, difficult to get in. So there's definitely issues with them. And so I said, this might be something for you. And so, what did you think when I said it? You think I was crazy?
A little bit. I mean, I was open to it, but I was nervous about the hard contacts.
Right.
And sleeping in it is just so opposite of what you're told to do all your life with contact lenses. So
Exactly. So, it's totally counterintuitive. You think, I'm going to sleep in the lens, and then I'm going to take it out. I'm going to remove it, and then I'm going to be able to see. So I have a few graphics here, and they're going to show, essentially when you put the lens on the eye, as you can see, when you put the lens on the eye, this lens is not shaped like a normal contact lens. It's not dome shaped. It's sort of plateau shaped. So when you put it on the eye, it gently shapes the outer layer of the cornea. The outer layer of the cornea is called the epithelium. And this layer of the eye is constantly sloughing off and being regenerated in a 7-day cycle. It's kind of like the outer layer of our skin. So it's very, very, very durable, okay? So what happens is this gentle reshaping of the front of the eye that occurs by the shape of the lens happens overnight. So when you take the lens off the next day, you can see. And a lot of people want to know then, does it last forever? Does it, how long can I do that? So let me ask you, how long, do you wear the lens every night?
I wear it every night.
Have you ever forgotten to wear it?
Maybe one time. And I was still okay. By the evening, I felt like I needed to put them in, but I was still okay for the workday.
Great. So, and that's what we notice. What we tell people is you're going to want to wear these lenses every night, and that the effect is going to last throughout the course of the next day. Now, you can probably do it you could wear it probably 1 or 2 nights and go 2 days without wearing it at night. But we recommend to get into a routine so it's it's well ingrained and it's good to go. So you can see in that picture that we showed how it changes the shape of the front of the eye. And so the nice thing about this is it's not permanent. When we talk about LASIK, LASIK is a great option out there. We do LASIK in our office. Some people aren't good candidates for LASIK, okay? You would not be a good candidate for LASIK because of your dry eye, okay? And some people don't want a surgical option. They want a non-surgical option. They don't want a permanent change. So this is great for people like that. But the other group of people that it's really good for are children who have parents that have a high amount of nearsightedness, and we're worried that little Johnny or Susie is going to turn out like mom and dad with a real high prescription and have an increased risk of retinal detachments and glaucoma and all of those types of things. So in that case, children are actually great candidates and probably make up the majority of my patients who are using these lenses. I have several 7- and 8-year-olds in these lenses. So what this does is it actually reduces the rate and progression of nearsightedness by 50%. Now we can't guarantee exactly the amount of reduction that will occur, but just as an example, if mom and dad are 7 and 8 diopters of nearsightedness and Johnny is 2, and he would have ended up as a 7, we would expect that maybe he would only end up as a 3 or a 4 if he were to wear these lenses nightly for the rest of his adolescent and teen years, where the eyes are changing the most. And so what this does is it changes the shape of the front of the eye, which changes the way light bends to the back of the eye, and changes what we think the neural signal is that causes the eye to elongate. So what orthokeratology does is it makes it such that you don't need to wear glasses and contacts throughout the course of the day, which can be great for your life, especially if you're active and the kids are active. But as a parent and for children, the awesome thing is that we're potentially reducing the likelihood that they're going to have retinal detachments and glaucoma down the line. And that's really where the rubber meets the road for Ortho-K and myopia control contact lenses. So again, we're one of the only ones in the area that do this. It's a quick, easy, simple, economical option for vision correction. So, if you're out there and you're thinking this might be something I'm interested in, stop in. We could just check you out and see a consultation whether or not you'd be a candidate for this. So stop in. And so what we're going to do next is we're going to go into another room and we're going to show kind of what the process is like in reference to being checked for this, whether or not you're able to wear Ortho-K lenses and whether it would help you, and how we follow whether or not it's actually working. So again, we're here at Hazleton Eye Specialists. We're talking about orthokeratology, a lens that you actually sleep in. And a good friend of mine here, Megan Natal, has been using for 2 years now.
Not even since May of this year.
Okay, so almost a year, and really liking it a lot, doing really well. And for her, she's been using it because of dry eye and contact lens intolerance, but great for children who could be potentially turning out to be very nearsighted individuals. And you sleep in it, you take it out in the morning, and you can see. What's better than that? Hey everybody, this is Dr. Deom here at Hazleton Eye Specialists and Stroudsburg Eye Specialists. We're here in our Hazleton location today and we're talking about sleeping in your contacts and correcting your vision throughout the course of the day. Ortho-Keratology lenses, or OK lenses. And I'm here with a great friend of mine, Megan Natal, who's been wearing these lenses for the last year, loves them. She's been wearing them because of dry eye, and we also think that they're great for children, children who maybe would be turning into nearsightedness as time goes on, because this has been shown to reduce the rate in nearsightedness progression by 50%. So if your child's out there and you say to yourself, well, I'm a -6 or I'm a -5 or I'm very nearsighted and I just hate that I can't see the clock when I wake up in the morning, and I would really like to not pass that on to my child if at all possible, then you should bring them in for a consultation for these lenses, these orthokeratology lenses. They could be great for children really of all ages. So we've children as young as 7 years old in these lenses and do really, really well with them. So what I want to do right now is just kind of take you through the process. It's really super easy. So first thing we're going to do is we're going to have you come into this little pre-testing room here. We're going to have you go to this machine, okay? And this machine right here is something called the topographer. So we're just going to show you real quick what happens when we do a topography measurement. So I'm just going to ask Megan to put her chin there on the chin rest, forehead up against the top bar. She's going to look into the machine there, and she is going to blink a couple times. I'm going to click the button, and it's going to take an image. You can relax. And so I actually have an image of Megan's eyes here back when we started this whole deal. And what you can see, if you look very closely at the shape of the front, so this is the front of the eye, her cornea. It is a topographical measurement. That means it tells us the peaks and the valleys of her eyes. And so what we're seeing here is the front of the eye is basically one color. You see a color scale on the side here, and the warmer colors, the hotter colors and the warmer colors denote steepness. That means that the individual is most likely more nearsighted. The flatter colors, or the darker colors, the blues and the greens, denote flatter, and flatter generally denotes a farsighted individual or less nearsighted. So you can see here with Megan's cornea, the shape of the front of her eye, this is her right eye, it's generally one color, which is a good thing. That means that it's spherical, and spherical eyes are very easy to do myopia control or Ortho-K lenses in. So this is her right eye, and sometimes we see astigmatism with people's eyes, and in that case we would see a more steep region of the eye located along a meridian, either up and down or left to right. So we would use this image in conjunction with the checking of her prescription to then determine what lens it is that we need to get for her. So we would then get her that lens and have her wear that lens overnight and then come back the next day. We would then come back to this room the very next day. We would have her take those lenses off and we would repeat this measurement, okay? So we'll do it again just for fun. So go ahead and put your chin in there, blink, look straight into the machine, and we're gonna go ahead and take that measurement one more time. Perfect, very good. Does that hurt at all?
No.
It doesn't hurt, good. It might tickle a little bit. No, it doesn't tickle, it doesn't do anything. There's no air puff test here. That's old, it's outdated. We don't do that at Hazleton or Stroudsburg Eye Specialists, no air puff. So you don't have to worry about that. So I'm going to pull up an image of her right eye, what it looks like now. Okay, and so here we have an image of her right eye. Okay, and you can see this is an image of her right eye. Okay, and so it looks completely different than what it did before. Remember, the last image that we had was all yellow, and there was a little bit of orange going up and down. So here we have the black region. This circle denotes her pupil. So that's where the light goes to the back of her eye. And so we see right here the green, and green denotes that it's actually flatter. So what we did was we took her eye that was steep and we made it flat. And what that does then is it changes her prescription. So the change in curvature changes her prescription. And you could see that when we flatten out that area by putting that lens on the eye, it takes the center part of the cornea, makes it a little flatter, so she's less nearsighted and can see. And in fact, if you were to take an individual who's had LASIK and did a topography measurement on them, this is exactly what it would look like. It would look the same. So when LASIK is done to the center millimeters of the cornea. And so is Ortho-K. Okay, so it's a very similar procedure. It's a procedure in which we are taking a lens, we're flattening out the center part of the eye, but it's not a permanent thing. It's not something that alters the structure of the eye at all. So we could do it in children, we could do it in adults, and we could do it in people who have a severe dry eye. So this is the right eye, and I'm just gonna pull up a picture of the left eye too to show you what the left eye looks like now. And you can see the left eye, we have a similar shape here. All that green, really nice green right there in the middle. Beautiful topography. And so now she's 20/20 in day and night with those lenses on. So now what do we do, right? So we have a situation where we have the lenses, she's wearing them, she's happy in them, she's seeing clearly out of them, and she is just rocking and rolling them, wearing them every night. So a lot of times people will say, well, what do I need to do next? Is this something I'll have to renew every year? Will I need new lenses? Do these lenses disintegrate? Do they fall apart? How do I clean them? So they're hard lenses, gas permeable lenses, which in the beginning is a little bit less comfortable than soft lenses, but it takes typically what, a couple days? Is that how long it took for you to get used to them?
Yeah, I'd say so.
A couple days, so 2-3 days. Remember, you're sleeping in them, so it's not like you're walking around in them, you feel them, you close your eyes, you go to sleep. So it's pretty easy. They are hard lenses. Hard lenses could last several years, okay? So it may be that these lenses last a year or two for you. However, we will check you probably in a couple times in the early week or two of wearing these lenses to make sure everything's going well and the shape of the front of your eye is the way that it should be, no issues. And we'll teach you how to take care of them. There's some solutions that are special for these lenses, how to clean them, make sure you get protein off of them and things of that nature. So we'll go over that with you, how to put them in, take them out, take care of them, and then we'll probably check in with you again in 3 months or 6 months. And at that point in time, we're just going to check and see, is everything still going well? Are you still seeing good? Is the prescription holding steady? Because remember, a lot of times these contacts are going to be used for people whose prescription or nearsightedness is changing rapidly. So we want to make sure that what we're promising, and that is that it reduces the rate and progression in nearsightedness, we want to make sure that that's actually happening. So we'll check that at about 6 months and then a year. Typically at a year, we're going to try and update your lenses. We're going to try and get you a nice new set of lenses so that you're having the nicest, freshest lens sitting on the front of the eye, because over time they can get scratched up and build up some debris on them, okay? So we will probably renew them, but at the very least we would expect them to last a year, sometimes more, okay? Now this is something that can be done forever. You could certainly continue Ortho-K lens wear for as long as you'd like. And in individuals suffering from dry eye, it could be a real lifesaver for them. It could really be a great solution. For children, sometimes we see children as they turn into their adolescent, teenage, 20s, 30s, sometimes they go back to soft contact lenses or glasses. It really just depends on the individual. But really what we wanted to do today was highlight this really new, exciting technology to our area, orthokeratology lenses. If you're out there and you're thinking to yourself, boy, I would hate for my young daughter or son to end up like I am with a high prescription, now's the time. Bring them in, allow us to have a consultation with you to determine whether or not the cornea is able to be changed by wearing these lenses with overnight lens wear. It's safe, it's effective, it's a great way to correct your vision, and I'll tell you, the kids love it. They absolutely love the fact they don't have to wear glasses or contacts throughout the day, especially if they're in sports, active, and really would like to be able to see well and do well during all those things. So thank you for listening today. Again, we're talking about orthokeratology. I want to thank my good friend Megan Natal and her family for coming out here today. It's been a great opportunity for Megan to be able to wear these lenses. Again, a prolific runner in our area. You'll see her run around on the street. She'll be wearing blinkers, don't hit her. We'll hopefully see you all here at Hazleton Eye Specialists or Stroudsburg Eye Specialists for an orthokeratology consultation today. Thank you.